full veneer doesn't necessarily have to reach all the way to the gingival level. It can stop short of the girdle and thus avoid undercuts even more easily. So if you start from the arrowheads, consider that from there up, you have a much better chance of dealing with the buccal side without undercuts. But we wanted to see anyway if we got to the palatal level with our walks up, if in fact the situation could change, and we'll see it in a moment. In the meantime, we finalized the provisionals. We've now created an ideal occlusal situation. The palatal part was not touched at all occlusally, and therefore palatally our teeth are intact. So we just prepared for veneers and gave an anterior guidance that could disclose the posterior segments during all excursive movements by means of provisionals that also guide the mandible laterally to the right and left without any posterior contacts, so no occlusal interference. So, a clinical test to understand how the full veneers work, even in the most extreme cases where it seems impossible not to have undercuts. In fact, on our left, you see the buccal aspect and the lingual aspect. It's the same preparation you saw before, only the interproximal buccal area is prepared, not the palatal one. Nevertheless, the dental technician manages to take out all 6 restorations, and then, as you can see to your right, they are molded and then ready to be inserted. So we were able to place all the restorations without preparing the palatal teeth, and then decide whether to make only veneers or possibly extend the preparations to the palatal level, because the palatal teeth were not touched at all. All the original enamel remained, so we completely preserved the tooth structure and obviously the enamel that was underneath.